It is the fourth Pan-African Diabetic Food Study Group conference holding in Abuja, the Nigerian capital, for the first time. It is a gathering of medical practitioners, health workers involved in diabetic management from Africa and Asia. Their aim is to improve management and prevention of diabetes-related food complications.
So this is Africa is going to be hit by diabetes very high, followed by Asia. Most prevalent and dreadful is going to be the diabetic foot, because diabetic foot is the one which can take your limb and even the life.
And in Nigeria particularly, the burden of complications of diabetes is quite high. So the diabetes food training that we are having is actually to build capacity for healthcare providers in the Federal Capital Territory and its environs.
So MSN is, joint venture with this Pan-Africa Diabetic Food Study Group into a long-term association. Okay, we want this to be partnership to proceed to the next few years, so that we are successfully able to launch this diabetic foot care center in the respective countries. This is what we want to achieve through this particular conference, to treat a lot more patients. So the moment more patients are being treated, so quite a few amputations will be saved if treated at the right time. So we are definitely, all those academic requirements which are there, we are going to support that particular center in the respective countries.
The Minister of Health, Isaac Adewale, who described diabetes as one of the major public health challenges, says this conference will foster more cooperation and synergies in fighting diabetes in the country.
That we do everything that is necessary to support your cause. We will, in fact, make sure that we go beyond checking for diabetes at teaching hospital. We want to mainstream it at primary care level.
We need to, have some behavior change in our lifestyle. We leave the naturally African or Nigerian healthy diet for the civilized diet. And this civilized diet that we consume in the urban setup, they are full of, salt, sugar, and bad fat. So these things, they stress the pancreas.
Diabetes is a disease that occurs when the pancreas is no longer able to make insulin, or when the body cannot make good use of the insulin it produces. It is not curable, but with better management and control, the patient can live as long as anyone else. Ogom Ezedimbo, AIT News, Abuja.